Welcome to the Big Unlock podcast, your leading source of info for insights and best practices in digital health and digital transformation. Join host Patty Padmanabhan, CEO of Damo Consulting and co-author of Healthcare Digital Transformation, How Technology, Consumerism, and Pandemic Are Accelerating the Future, in conversation with leading practitioners of healthcare and technology. This podcast is sponsored by Health Next, the enterprise-class virtual care platform from Tech Mahindra Health and Life Sciences.
Hello again, everyone, and welcome back to my podcast. This is Patty, and it is my great privilege and honor to introduce my special guest today, Anshul Pande, VP and CTO of Stanford Children's Health. Anshul, thank you so much for setting aside the time, and welcome to the show.
Thanks, Patty. It's great to be talking to you, and all the good work you've been doing has been well received and appreciated.
Thank you so much for that. So let's dive right in. Could you give us a little bit of an overview of some of the digital programs that are currently operational at Stanford Children's?
Yeah, so our digital journey has been there for many years now. We were in the forefront of what was happening from a digital perspective for pediatrics. And some of the things that we did, it made sense for us very early on to start investing in terms of thinking about how to do remote monitoring, how to get that data, and then how to make the clinician's life easy in terms of being able to use that data that was coming from digital monitoring programs. Right now, like everybody else, telehealth expanded considerably for us. And likely so. And the work right now has been around ensuring that we still retain very high levels of telehealth post-COVID. So as a good example, there's a massive work group behind the scenes to understand what happens post-COVID and what will be the barriers for us to stay at high levels of telehealth. And then how do we eradicate those barriers, right? Whether they're regulatory barriers, billing barriers, or experience and equity barriers. So that's really huge for us. And then besides just the telehealth and the remote monitoring portion, there's a ton of work going on in terms of process improvement and process optimization, as well as new business ideas in terms of how we use digital to take care of patients a different way and to integrate and connect and attract patients from all over the country, if not the world, for things that we do better than anybody else. And after that, once they have had the procedure, to be able to take care of them remotely while their local physicians take care of their day-to-day needs, as the case may be.
Yeah. Now, you're a children's hospital, and obviously your population is a little bit different from adult populations. Right. So what makes your population unique when it comes to enabling care using telehealth and remote monitoring and other digital health tools?
Yeah, so one of the interesting things is, and it's a good thing, is that kids overall are healthy, right? So all the things that we as adults have that are usually tied to how we took care of our bodies or did not take care of bodies or genetic factors, kids usually don't see that. So the biggest challenge is the number of, the N for us is really, really low, right? So I'll give you an example. We're working on a program to be able to do electrocardiograms at home, that we could give that machine to a parent and say, get us these images remotely. And the N for that program is probably 12 or 15 at most in a year, right? So the programs are really unique in terms of the size of them, which also makes it more complex, because the biggest challenge we have faced is that a lot of the devices are really, especially on the home monitoring front, are really not made for kids, because the financials don't work out for the monitoring companies who develop them. So we're kind of an afterthought, which makes some of these things even more challenging for us to build, design, and develop.
Yeah, it's interesting you say that. In many ways, even though your patients are children, the users of the technology may be the parents. And Correct. So you're designing both for the children and for the parents. That makes it a very unique dynamic, I imagine.
Absolutely. And it's a fidelity issue too, right? So if you think about just a simple thing as a weighing machine, the fidelity we're looking for is a newborn where, we're looking at grams of fidelity, not pounds of fidelity, as an example. So that's interesting and challenging by itself. and then to ensure that a parent can handle it, and then the data can be sent from a remote device back to us. So yeah, definitely some very, very unique challenges in terms of getting all of those pieces to work together.
Yeah. So let's talk about the technology itself. In your role as CTO, how do you go about assessing your technology choices when you're implementing digital programs? And what do you see as the role of the enterprise IT system, the EHR system, as an example, in your digital roadmap?
Yeah, so it's not just the EHR, but probably 5 or 6 core technologies that we think as our basis for almost everything. And anytime we have a unique problem that comes from our business or from our clinicians to say, look, we want to do X, one of the first things is to say, okay, how do we design for X and how do we solve it? But more importantly, with the solution set that we have, whether it's the EHR or the ERP system or our telehealth platform, is to say, can these things somehow provide that solution? And then the next part comes in and say, if the answer is no, then who can do it? At that point, it's a buy versus build decision. And in a lot of cases, it is, yes, we think this vendor can provide the underpinnings for it, but we may have to build a brand new connector that has never been done before. But the thought process, again, use the core technologies that are available today with partners that we have had long relationships with, or find a new partner, and then subsequently looking at what we have to build in-house by our own developers.
So let's talk about a specific case here. So
Yeah.
today, EHR systems have evolved over the last several years, and they now offer a lot more functionalities that would be considered digital functionalities. So when you're left with a choice of using a quote unquote native capability from your core EHR system, is that your default, or do you look at alternate solutions that may be best in class, standalone solutions? And after all, you're in Silicon Valley, there's no dearth of standalone solutions, innovative solutions. How do you make those trade-offs? Where do you begin? Could you walk us through a little bit of the thinking when you come to this kind of a situation?
Absolutely. So I'll preface with an example that we just brought online a few weeks ago. One of the things we were struggling with telehealth was the whole structure around telehealth was built on a patient getting a message through the patient portal, which means that they have to have an email, right? And one of the things we found out from our patient community was, from an equity perspective, a lot of people had smartphones, but not every smartphone owner had an email address. So how do you ensure that you can still send a telehealth visit information or a starting URL on text, right? And so our answer is, well, let's go to the EHR group and find out, have they done something like this before? Is there a solution that they have available? And the answer is no, they don't. We said, okay, let's go to our telehealth group and find out if that vendor has a solution for it. And the answer was no, because if you think about it, the vast majority is using emails as a starting point for a conversation, including you and me talking about it today. And then we start saying, okay, we have to send text. Let's figure out with our text messaging system provider. And they said, yes, we can, but I need this information from you. And finally, we ended up creating our own bridge. Within an EHR today, a provider can say, I have a choice to start my telehealth visit by sending a message to the patient and their families via email or via a text message. And that required all of that work to happen and some amount of development from our side to actually make it into a reality.
Wow. These are some of the assumptions that we live with, right? I would never have thought that you could have a section of your population that owns smartphones but does not have an email ID. And that is just simply beyond my thinking, at least. But it's very illustrative and informative, because digital health, implementing digital health solutions, from everything I hear, is about all these small things. You're trying to cover everyone in your population, not just a certain section of your population, and you have to take care of everybody. So coming back to the topic of the technologies, now you talked about the fact that you're looking at 4 or 5 technology platforms as the core, including the EHR platforms. When you talk about digital experiences and creating the digital front-end experiences, there is a lot of tools that either are native to EHR, or you're getting it from the outside, or you're building it yourself. What about the backend infrastructure that needs to be in place for all of these solutions to work well work seamlessly, and for the user, whether it is a caregiver or a patient, to feel like this is all intuitive, easy to use, and is working.
Yeah, that's a huge problem. When we started on the telehealth journey several years ago, one of the things we were realizing very early is that this is the first time we are actually going out of our comfort zone of our clinics and our hospitals where we could actually manage that experience. We were managing the network, we were managing the device, we were managing prioritization even within the network to say, this traffic should go first and all. And we were reaching a point where we were like, gosh, we don't control half of the journey. We absolutely don't control the patient's device. We don't control what network they're on. We don't control how buggy or busy that network is and how many other things are running on it, right? And so there are really two thought processes out there around solving it. One is on the core infrastructure side. It's like, what can you do to make it better? And how do you solve that particular problem? And we did a lot of work on our own infrastructure side to say, okay, how do you scale up? What happens when you have to have, instead of 20 visits a week, to thousands and thousands of visits happening a week?
Yeah.
And can your network and your substructures actually scale up to it? But then the second part was a conversation with the software vendors to say, how do you handle network drops? What happens when a patient moves from Wi-Fi to a 4G to a 3G? And how do you gracefully handle that experience for a provider, and for a provider as well as a patient, because there'll be frustration on both sides, right? If you're not able to have an optimal experience. So a lot of work went into just understanding the differences in terms of how the software layers are designed. And it led to us actually changing our telehealth platforms midway through COVID, because we saw one platform performing much, much better than our existing one. But those are things you have to continue to do. There are software companies that are leapfrogging each other, and you got to take advantage of it. And it's more so than ever in the virtual cloud space, where the speed of innovation has increased tremendously, and at the same time, the options that are available are more too.
Yeah, let's talk about some of those emerging technologies. What excites you now, both when you talk about the front end, that is at the experience layer, and at the back end, which is at the infrastructure layer?
Yeah, front end, there's been quite a bit of work. I think on the device side, we are super excited with our partnerships with Apple. They're doing some really, really interesting things, including dropping their device prices. That makes it more palatable for us to be using them within our systems. We are super excited with what we're doing with Zoom on the telehealth side. They have really created a platform that has not only caught the public's attention, but it's actually very, very usable and scalable and robust from a telehealth perspective. We are also looking at a number of groups, whether it's Automation Anywhere or UiPath or Olive, which provide different frameworks for RPA and AI-based RPA, which is getting to be very, very exciting. And then some of the things that are coming from Twilio and Well, in terms of the patient engagement side and the connectivity with the patient across multiple platforms is super exciting.
What about voice? Are you using voice in any meaningful way?
That's a good one. Voice has been something that we are still looking at to see how it plays out. One of the most interesting things is the population we are in. So there are two languages that really dominate the market we are in, English and Spanish. But then right after that, we have another 30 or 40 languages where we have populations from all over the world, and therefore are just as important to communicate with the patient and have that conversation. And that's the piece where voice has become an interesting conundrum for us to solve, is that do we bring an interpreter most of the times into the conversation, or is there a better way of handling it? And we haven't really solved that problem yet from a communication perspective. So it's an ongoing issue, and it's an ongoing journey in terms of how we are pushing and prodding our software providers to say, how are you going to help us solve this part of the journey, which is really, really important to actually have that meaningful communication between the provider and the patient.
Yeah. What about the risks? Now, we talked about, all the companies that you mentioned. Some of them are very mature at one end of the spectrum. The others are very young companies, and in many cases, possibly VC funded, and it comes with the challenges of financial and technology risks. How do you manage them?
Yeah, that's a good question. I think it goes into part of when we are doing the selection process, right? So we are looking at understanding, will these companies be sustainable? Look, we are not a innovation hub or anything where we actually provide the seed funding and stuff like that. Several of our partners are doing it, and great organizations. Cedars has a phenomenal program. Providence has a phenomenal program. Cleveland has had a program for a long time around it as well. So, that's not our MO. So we are not looking for really, unless it's a very unique one-off solution, to be looking at that earlier stage. But that comes into the conversation when we are selecting a partner to say, what's your sustainability like? Can you actually continue to support us for multiple years and mature with us, especially if you're looking at an emerging area? And there's conversations around, what is the financial stability or viability of the organization? What's the excitement level of the market around it too? So all of those things get into that decision-making process for sure.
Alongside these kinds of risk mitigation aspects that you just talked about, what about the financial side of it? Have you changed the way you look at building business cases for these kinds of tools, considering where you're headed as a digital first or a predominantly digitally enabled organization? Are there trade-offs that you need to make today and make them from a strategic perspective as opposed to a hard ROI? Has anything changed?
Yeah, that's a good question. It has changed a bit, right? So COVID has done a few things. One, it has allowed us to experiment much, much more rapidly. It's also allowed us to fail much, much more rapidly and move on, right? So fail fast, get comfortable with experimentation. And that's been wonderful. Without those two things happening, I don't think we could have made the number of useful changes from a technology perspective in the organization. Regarding the ROI piece, I think that's the other interesting thing. Certain things are now considered obvious and part of how we need to run our business. In fact, our entire executive leadership team is very gung-ho on digital first across the board, right? So they have bought in, our boards have bought in. And this was before COVID, by the way, from our own journey perspective. So the discussions are slightly different. I think the discussions are not always about ROI. And ROI comes into play. There's no question about it. But ROI comes into play when we are looking at a replacement of X to Y. I think in other cases, ROI is discussed when we are looking at a brand new idea to say, okay, if we have to really pitch this idea, how much does it have to scale before we are actually making money on it? Right. And so that gives you at least a clear line in terms of what the adoption has to be, what the usage has to be for something to be actually meaningful and valuable, which is always a good thing from a business perspective. But yeah, we are experimenting a lot more, and there's a lot more thought to saying, if it is a good idea, let's invest in it.
Yeah, and you're right there in the middle of Silicon Valley, where you have ample opportunity to experiment with new technologies, if nothing else, right? I'm sure there's a lot of people who want to experiment with you. Okay, we're coming up to the end of our time here, Anshul. This has been fascinating. I want to leave you with one last question here. If you had to share one best practice with your industry peers who are on their digital journeys, what would it be?
Oh, that's an interesting one. I think engagement is important. So connect with different parts of your organization and come up with a single mission for your organization. That has helped us tremendously. It gives a lot of clarity when your CEO is providing the vision of what digital means and what digital could look like for your organization. And it also helps you through the peaks and valleys. It's a long journey, and you will have peaks and valleys, but having that commitment from the very top helps tremendously.
With that, we're going to have to leave it there, but it's been such a pleasure speaking with you, Anshul. Thank you so much for setting aside the time, and all the very best to you and your team.
Likewise, Patty. It was great talking to you.
We hope you enjoyed this podcast. We invite you to subscribe to our weekly newsletter, The Healthcare Digital Transformation Leader. Write to us at info@thebigunlock.com with your feedback and questions.